Hi, I'm Dr. Shannon. I'm an Ontario-based naturopathic doctor with a focus in hormones, fertility, and pregnancy. And today I want to chat with you about how to use an ovulation prediction kit to track your ovulation. So a quick understanding and background, tracking ovulation can be really helpful when you're trying to get pregnant because it allows us to understand when in your cycle you might be ovulating and allows you to time intercourse appropriately. This is like the key number one first step that needs to happen if you're expecting or hoping to conceive naturally. If we don't put egg and sperm in the same place at the same time, we're not going to get pregnant. So this is kind of baseline information. We need to make sure this is happening at minimum. There's a lot of other steps that have to occur that are outside of our control before we're going to see a positive pregnancy test, and certainly 9 months later before we're going to have a healthy baby. But this is kind of, like I said, the baseline, and we need to make sure this is happening. So tracking ovulation allows us to time intercourse appropriately to allow us to kind of take that first step in getting pregnant. So an ovulation prediction kit, sometimes called an OPK, is essentially just a little test strip. I have one here to show you. It looks a little bit like a pregnancy test. There we go. And it's tracking a hormone in our urine, or testing a hormone in our urine called LH, which stands for luteinizing hormone. Luteinizing hormone is kind of running at baseline and a low level in our body all the time, and it's going to rise, peak, and fall during our menstrual cycle. And that peak is going to happen just before ovulation occurs, about 12 to 36 hours prior to us ovulating. There's certain people who are not going to have this happen in a predictable way. I'm thinking particularly of people who might have PCOS or polycystic ovarian syndrome. This tool might be a little frustrating to use or challenging to use because we might be seeing multiple LH peaks throughout your cycle. It's your body's way of attempting to ovulate, unsuccessful, attempting again, unsuccessful, attempting again, unsuccessful. And or some people with PCOS have a constant high level of LH in their body all the time. And so that's going to mean your tests are constantly coming back positive. It doesn't mean you're ovulating all the time. It just means that there's another condition, a physiological reason why that LH is high. But if you're someone who does have a regular menstrual cycle, meaning it comes relatively frequently like clockwork once a month or so, this can be a really useful tool for you. So I usually recommend starting to use an ovulation kit or strip starting around day 8 to day 10 of your cycle. Again, this might depend on how frequently you get your period or how long your cycles are. But starting here allows us to make sure that we're using it long enough to capture that ovulation window. So I usually recommend starting on day 8 and then testing once every 24 hours until we've noticed a peak and a decline. And once we see that the tests are consistently negative again, then you can discontinue using them. So what we're going to see, and I'm going to bring my test strip back up for you, is when we use our test strips, we're dipping this in a cup of our urine. I didn't bring my pee to show you because I didn't think you'd want to see that. But we're seeing 2 lines show up on the test. So you'll see there's one line here that's quite dark, that's called the control line, and one line here that's quite faint, which is called the test line. So this is indicating this is a negative test. When the test line is lighter than the control line, we call that a negative. When it's just as dark or darker than the control line, we call that a positive. And its darkest level, or when it's the darkest, the test strip, or test line rather, that's going to be a peak test. So we're going to see negative, 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 positive, positive, peak, positive, positive, negative. And that's going to kind of show that surge and decline in our LH levels in our body. So using the test, like I said, is pretty straightforward. I always recommend, regardless of what brand you purchase, is to follow the instructions with your kit. Some are going to recommend using first morning urine. Some are going to recommend using afternoon urine. That's, for the most part, it's recommended to use urine from the afternoon. They're all going to have a different amount of time that you have to hold it in your urine, let it dry, et cetera, et cetera. But usually you want to let it dry and interpret it within about 5 to 10 minutes. Anything later than that, like if you forgot about it and you look at it 60 minutes later, it might not be completely accurate at that point. So you want to test and interpret it pretty quickly. Some of these ovulation test strips are more fancy or have a little bit more offering in that they're a digital reader. So that's going to tell you negative, positive, or peak on a digital reading. Whereas these ones that are really inexpensive that you can buy in bulk, do require some user interpretation. So why this is important and understanding when you're ovulating. So remember, a peak test is going to mean we ovulate in the next 12 to 36 hours. If we know when we're ovulating, we can time intercourse appropriately. Sperm can survive inside the reproductive tract for up to 5 days if they're really healthy and in kind of optimal function. So if, for example, you had intercourse on a Monday and then you ovulated on a Friday, technically the sperm from Monday could ovulate your egg on Friday. But we might have had a negative test on Monday, and so we might have thought, oh, I'm not ovulating yet. So in any given month or at the time when we see a positive test, that's a good day to have intercourse. It means ovulation's happening soon. But month over month, we can start to gather some data about our cycles and understand some patterns. So maybe after 3 months, you notice, you know what, for the last 3 months, I've always ovulated on day 17 or 18. So then we know, okay, if we subtract 5 days, we can start to have intercourse on day 12 or 13 and know that if we have intercourse every day or every other day leading up to ovulation, we're going to make sure that sperm and egg are in the same place at the same time. Once our egg has been ovulated, it can only be fertilized for about 12 to 24 hours. It's a pretty tiny window of opportunity. So we do really want to make sure that, like I said, at minimum, we're putting sperm and egg together in the same place at the same time. Lots of factors can influence ovulation. So like I said, PCOS is a big condition where it can make this whole testing thing a bit confusing. So I certainly work with a lot of patients who have this, who are having trouble interpreting their test results. And we kind of dive in a little bit and understand uniquely and individually what's going on with their cycle. I would say 3 other things to consider. One is stress. So at the time of filming, we're in the midst still of that COVID-19 pandemic. So we know that a lot of people are having stress and a lot of people are noticing wonky things with their cycle. So stress is going to delay the time to ovulation. It's our body's way of saying, she's a bit stressed right now. It's probably not a good time for her to get pregnant and bring another child into this world. Same thing with illness. If we're sick, again, our body might be like, now's not a good time. Let's wait until she's feeling better. So ovulation can sometimes be delayed. The thing we're not all experiencing in the midst of this pandemic is travel, but that too can influence ovulation. So if you're watching this sometime in the future, and we're traveling again, know that if you are traveling, particularly if you're traveling time zones, that can influence ovulation and delay things a little bit as well. So you might notice that cycle to cycle, there's a bit of variation based on other factors that are influencing your ovulation. So if after all of this, you're like, whoa, I have no idea. I've been using these strips. I'm super confused. I would love to work with you further. If you head to my website, www.shannonnd.ca, so SHANNONND.ca, and click on the button on the top right corner that says Get Started, you can book a free complimentary 15-minute discovery call. We can chat through your cycle, understand what's going on for you, and see if working with a naturopath is the right next step. If you have any other questions, feel free to shoot me a DM, comment below, and I'd love to hear from you. Hope you have a great day. Take care.